And while a local doctor says everyone agrees health care reform in the United States is necessary, that doesn't mean a government-run plan is the best answer. Christy Lee is just back from speaking with a physician from Mercy Health Partners. She's live now with his take on President Obama's announcement on health care.
On the positive side, Dr. Ken Bertka says it's a great idea to give coverage and access to the more than 45 million Americans who don't have insurance. But although that sounds good, some are concerned with how it would get paid for and how the system would work.
So coverage is that you have an insurance plan that will pick up, that will pay for, that will cover your health care. Access is the ability to get in to see a physician.
And Dr. Bertka says under a government-run universal health plan, access to physicians might be limited. He says that's because there is a shortage of primary care doctors who would see an influx of patients. Only 30% of U.S. doctors are primary care physicians. That is a family doctor or the doctor who would give you a referral, compared with more than 50% in other countries. He says there's also a concern that payments to doctors would be very low and wouldn't cover all the services needed.
So the concern is that you could, in essence, give people the coverage, but there wouldn't be access to the services they need.
And that the services you could get might be limited.
It's whether or not you'll be able to get things done that maybe are not considered basic services or fundamental services.
Dr. Bertka says one of the major concerns is how Obama's 10-year trillion-dollar plan would be paid for.
And if that public plan is subsidized by taxpayer dollars, that means taxes all need to go up.
As for how the plan would affect physicians, Bertka says there would be good and bad aspects. A potential single public plan could streamline protocol, thereby reducing paperwork. But
most physicians, I think, are concerned that a public plan would, in essence, be Medicare. And we know there are huge issues with Medicare right now in the U.S. Number one, it's going broke.
Ultimately, Dr. Bertka says while a major health care overhaul is needed, there is a lot that could be done in the current system to make it better without having a publicly paid for plan. But he also adds a government-run program could work as long as it is well thought out and not rushed through like other legislation that has been rushed through in tough times. Reporting live this afternoon, Christy Lee, Fox Toledo News, first at 4.